Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Rakesh Jain, Clinical Professor, Department of Psychiatry at Texas Tech School of Medicine in Austin, Texas, to talk about Tardive Dyskinesia, or TD. It's a chronic condition characterized by uncontrollable body movements that can occur in one or more areas of the body. TD is associated with taking certain mental health medications, and with May being Mental Health Awareness Month and Tardive Dyskinesia Awareness Week in May, we're here to talk with Dr. Jain. Thank you so much for joining us.
It's my pleasure, Neil, and I'm so looking forward to talking about an issue that is grossly under-discussed in the field of healthcare.
I'm glad that you're here. Would you tell us a bit about why Mental Health Awareness Month and Tardive Dyskinesia Awareness Week are important?
Oh, my goodness, I'd be happy to. So if you kind of think about it, if you step back for a second and recognize that mental health is one of our greatest and fondest possessions, right? We certainly like our big homes and fast cars and all that good stuff, but what could be more important than mental health? And shining a spotlight on mental health is a necessity, not just for a month, but really literally for an entire lifetime. But the problem is, Neil, many of us aren't so blessed. And many of us need help, and we get psychotherapy, and some of us actually need medications. And certain medications like antipsychotics can cause, as you said earlier very accurately, an involuntary, abnormal movement difficulty of muscles in our body, like our face, our tongue, our eyebrows. It can be our hands, it can be the rest of our body, and that causes a lot of impairment. So the goal of the Mental Health Month, and more particularly the TD Awareness Week, is to shine the spotlight on the plight of about 600,000 Americans. You heard me correctly, 600,000 Americans who suffer from this very problematic condition.
Well, give us a bit more insight into tardive dyskinesia. What are some of the symptoms, and who's most likely to suffer from TD with their mental illness?
Yes, and I so appreciate this opportunity to have this deep conversation, and I would like to thank Neurocrine Biosciences for sponsoring this conversation and really appreciating that unless we talk about it, unless we're educated about it, we cannot make progress at all. So to directly answer your question, it really is these voluntary muscles. So right now, as I'm talking to you, I'm using my tongue. I'm using my face as I am articulating my words. I'm moving my hands as I'm talking to you. When I got dressed this morning to come to this interview, I shaved, I brushed my teeth, I made my breakfast. All of those are voluntary muscles. I moved over to come sit at my desk. My feet have voluntary muscles. What happens with tardive dyskinesia is, for no good reason, these muscles can start moving. And when that happens, there is significant impairment. I might cut myself while I'm shaving. I might drop things when I am trying to cook. And of course, if I'm dealing with a patient or someone at Starbucks, I might be very embarrassed about, I'm making faces at people. So I might socially hide myself, not go out in public, stop working, for example. So it is really a terrible combination of these abnormal movements combined with the impairments that come from it. And the good news about it really is these are highly treatable conditions now. That's the silver lining here.
So what is the go-to treatment for TD?
Yeah, so in the last 5 years, FDA has approved 2 medications for the treatment of this condition. But, before we really go talking about treatment, I think the crucial thing is identification. Destigmatization and identification, right? And that's why I would absolutely love to direct all of your listeners to talkabouttd.com. Talk, T-A-L-K, abouttd.com. And in that website, what you will find is very lovely description of what is this condition, what does it look like, how are families impacted by it, how are patients impacted by it, and how to initiate a conversation with your healthcare provider about, hey, is TD a challenge for me? If it is, what are my options? And just remember, the silver lining is actually really key here. The more we talk about it, the more we destigmatize it, more people go seek treatment in their health. And all of it can start with going to talkabouttd.com.
What about misdiagnosis? Is that something that has been a problem with TD in the past? And is it still a problem now?
Yes, and yes, it is. TD can be sneaky. It can often be even missed by the very patient who has it and by the very clinician who is taking care of the patient. And misdiagnoses do happen. But let me again share the good news with you. We are in the process of educating thousands, if not hundreds of thousands of healthcare providers in what the symptoms look like, how to conduct an appropriate examination to accurately identify TD. But the truth is, the journey often starts with the patient alerting the clinician something isn't right. And that's why this talkabouttd.com website, I think, could be the beginning of a wonderful journey for the patient, the clinician, as well as the family of the patient.
You mentioned earlier in our conversation hiding oneself socially because of the embarrassment and the unpredictability of TD. How difficult of a conversation would it be to get a patient to finally consult a physician to say, hey, something is wrong with me?
Yeah, it can be difficult. It is so hard for people who have major psychiatric difficulties to say, oh my God, I have one more problem to deal with. The challenge is if that conversation doesn't happen, patients really do suffer. So the way I approach it, maybe that's perhaps a better way for me to tell you. The way I approach it is I am always curious and interested in understanding the whole patient, not just pieces of the patient. And I'm always interested in the mind, the brain, and the body. And the guidelines for clinicians say you got to look for TD. You are obligated to look for TD when a patient is on certain type of medications like antipsychotics. And of course, I tell patients that be my partner. If you see something, say something. If you see something, say something, because I often need your help. So while the process can be a bit challenging, the truth is TD is actually relatively easy to diagnose if it's on your mind. And patients can become my partner, especially when they get educated by visiting a website like talkabouttd.com. So the team between clinicians and the patients and their family members can be very powerful.
Well, once again, as I mentioned, May is Mental Health Awareness Month, and May the 1st through the 7th is Tardive Dyskinesia Awareness Week. We've been talking with Dr. Rakesh Jain this morning. He's been talking about tardive dyskinesia and some of the stigma surrounding it and some of the treatment options that are available. Thank you so much, Doctor. Would you once again give us a website where we can learn more about TD?
Of course, I'm always happy to do that. talkabouttd.com. I invite every one of your listeners to come check it out, including yourself.
I appreciate you joining us here on Health Professional Radio. Thank you so much for your time.
Thank you for your time.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Rakesh Jain. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.